Good to see you all. I'm Director Jojeong of Tetrasignal, and I'll present about CBS's platform introduction. Originally, CEO John was supposed to present today's event. However, because of his personal circumstances, I will be the presenter today instead of him. Nowadays, the medical field is so advanced and professional that when it comes to education, prevention, diagnosis, and therapeutics, there are various technology and methodological issues, and there are a lot of inefficiencies. And our company, Tetrasignum, based on XR, we would like to get rid of that inefficiency with our advanced ICT technology. So we are putting efforts on that regards. Our vision is using the potential XR to cover diagnosis, treatment, and education and prevention. So we will provide various healthcare solutions. By year 2025, we will be the global standards of VR healthcare. So under that motto, our staff members are working hard on it. So IT technology in the medical field needs a convergence of two different fields, and that is really difficult to approach. I will, of course, mention it, elaborate it later on, but Tetrasignum has a lot of specialists in various fields like surgery and chest surgeons and mental disease, among other fields. And we make use of this XR and big data, among other high-tech ICT technology to bring this to life. So I'll move on to details of our company. It was founded in July 2019, the first of its kind of bringing virtual reality CPR device. In 2020, we got approval from KOTRA and Ministry of SMEs and Startup, and we won our patent, and currently expanding to British and among other countries. So we're working on MOUs to expand to overseas market, and including Minister of Welfare, among other special experts, are directly providing their support, and including our CEO and other medical specialists are directly engaging in this field. And after this approval and licensing, ICT professionals are realizing this idea and work on marketing and sales, and that is the process. Well then, let's move on to our CPR training and education. Before I move on, I'll show you a video. It'll take about 5 minutes. On a day, there is a man in his 60s suddenly fall on the floor because of a cardiac arrest. A lot of citizens gathered together to help him, and there was a firefighting truck who stopped to help this gentleman. Let's take a look at the CCTV video clip. Reporter Han Ji-won. In a daylight, a man was suddenly fall on the ground. His company gets confused, and a woman rapidly rushes to him. Without even dropping her backpack, she begins CPR. They were total strangers, but all the desperate help continued for 3 minutes. Then a firefighting truck stopped on a red light, and a citizen stops the truck and asks for help. And a firefighter replaces her and begins CPR very quickly. Another firefighter brings in automated external defibrillator to the patient. So we just finished firefighting in nearby Songpa, and a citizen came to us and asked for help that there is a fallen person there. Thanks to the rapid response, and the ambulance, an amalgam of a fire pump truck and ambulance equipped with AED. All the three factors coincided to save the life of the gentleman. The woman who did the immediate CPR did not leave her name or contact number and just left the place. I feel so thankful that they saved my life. And I was so lucky, I think. So thanks to all the response, I saved my life. I feel so thankful to them all. Han from SBS. Like you just said, I saw. So in as of 2018, there were about 30,000 cardiac arrest patients, and it happens in our daily lives. And unfortunately, 95% they lose their lives or they fail to go back to their daily lives, especially in Korea. Only 2.4%, Japan 8.8%, United States 9.6%. As you saw from the video, when a patient suffers a cardiac arrest after the golden time, 3 to 4 minutes, the death rate significantly increases. Even in Korea, where we have a good medical system, it takes about 7.5 minutes for an ambulance to approach. So there are continuous happening of these unfortunate cases. On the other hand, people at the age of 19 or older, back in 2019, only 38% of grown-ups experience CPR education, only those nominal theories or training, like lectures. So there is a raising question and if they are really effective. So we wanted to continuously provide high quality experience-based training so that citizens, without any hesitation or worries, can they conduct CPR on patients. So self-driven education solution was needed. So that's why we began developing this service. So not only in Korea, but it has marketability overseas as well. So this is the CPR education system where medical staff or other ordinary citizens can easily learn and practice. So it's a self-driven solution, like streets, classrooms, like schools, or anywhere you can set certain situations in the application and learn the accurate CPR measures. So when an emergency actually occurs, you can practice CPR with confidence. So this will change the paradigm of CPR training. And I'll move on to our products details. A touchable display and various sensor adapted mannequin and VR device that can increase the sense of reality. And on top of that, we also provide digital content based on VR. Based on the CPR system, we have a patent. So consistent and safe education is secured, and various trainees can get education, and there are sensors for each steps. So we can have a qualitative approach to analyze the results. This is a sample screen of the VR application. And here is a sample video. So you just saw CBS 2.0, fair education content. You don't need a specific installation or manual, and you don't need a separate instructor. So everything is done all in one on the screen, and the trainees training will be analyzed from the sensing. So it's very easy to use and convenient system. But the CPR Association's official guideline, we follow them as well, and very renowned medical experts from home and abroad provide ideas. So based on that, we designed various scenarios. And when you use this CPR platform, the medical costs and HR costs can be reduced by 60%, and the education time can be less than an hour. And especially there's no spacious or time constraints. You can go do one-on-one self-driven education. So it's likely to increase the education efficacy by 400%. The self-driven CPR platform analyzes all the interaction of the trainees and trainer, and not only the time spent and how deep the compression was made on the chest, the consciousness and breathe, among other like 20 categories. We accumulate data and analyze them. And in order to advance CPR education, we make use of them to come up with an even more advanced technology. And each hospital or official offices, among others, can make use of this guideline. So far in Korea or the US, UK, Singapore, like those hospitals are making use of our platform to work on clinical research and work at public organizations, and they're expanding the scope. This is another slide. The CBS 2.0 that we recently developed. We're working on marketing and business. So based on the demand, there were some demand for customization. So this is a CBS Mass model, which is aimed for a number of students that can be trained at the same time. So we're working on this. We're planning to launch this business in June. CBS Mass uses VR and monitors, so you can simultaneously conduct education in two different ways. So a big number of students can learn CPR, and the instructor can use a all-in-one tablet to see all the students' information real time and correct them. And after the training, they can analyze the data and come up with score rankings and analyze the results and manage the data. And also, the sensors, like location or pressure sensitivity, tilt sensitivity, among others, can be considered to come up with a real-time platform, and we can come up with infant-oriented hardware and software. So we're in partnership to come up with a mannequin. So anywhere, any place, anytime, even young people, the youth can learn CPR. So we want to broaden the scope of CPR education. And here is a child who receives CPR education, and we'll take a look at how he acts after this CPR education. Hey, I feel so dizzy. Hey, excuse me. Hey, are you okay? Hey, excuse me. Please call Korean 911. Please call the ambulance. And please, man in blue. Please ring me an AED. Sure. Hey, why are you pressing here? You're not counting numbers? 22, 23, 24, 27, 28, 29, 30. Hey, you can stop now? So based on the advanced medical expertise and technology, we learned that how difficult it is to converge the two. But if there's a way, then we can actually come up with a way. So we staff are putting all our efforts on this. Thank you.